Hi, my name is Priyanka Nayak. I am a board certified internal medicine physician as well as a certified life coach. Professional moms, I work with them to get out of survival mode and step into their best lives. And I'm doing a video today to talk about anxiety. So, one of my least favorite things about being a doctor is that people often want a pill solution to everything. So, and don't get me wrong, especially when it comes to psychological issues, illnesses, etc. Oftentimes people do need a pill. It is beyond the scope of, coaching or therapy, etc. I'm more talking about, the kind of anxiety it's there, but, you're fully functional. It's not making your life a living hell. Anyway, I go into this assisted living to see patients, a lot of elderly patients, and the staff, they give me a rundown of, who needs what. And one of the patients, the staff members were saying that she needed Ativan for anxiety. And I go to see her and I said, "Hey, the staff is saying, how's your anxiety? Are you anxious?" And she says, "Yeah, well, I'm an anxious person. I've always been an anxious person. I am anxious. I will always be an anxious person. That's not going to change. That's just how I am." I said, "Okay." The staff thinks that maybe you could use something for anxiety like Xanax or Ativan. And she said, "No, I really don't want another pill. Like, I take enough pills and, the anxiety is just there and I live with it. It's fine." And it just, I really related to her and I connected with her in that moment. When I started practice, I used to feel anxious a lot. And I remember I told my therapist, and this is actually really sad in retrospect, but I told her, "I hate my anxiety. Like, I can't stand it. Like, I loathe it." I use the word loathe. And in retrospect, I mean, that's just really sad. It makes me sad to think that that's how I felt. But regardless, this is pre-coaching and my systems in place. But I couldn't stand anxiety. I hated the feeling. I just wanted it to go away. Which leads me to kind of what this patient is saying, which is sometimes, not sometimes, so if you do feel whatever feelings you have, be it anxiety, stress, other things, sometimes you can just accept and make your peace with it and realize that it's there. It's not going to kill you. It's not going to harm you. If it's bothering other people, well, that's their problem, actually. And the sooner we can acknowledge anxiety and really let it sit with it, let it be, and feel it in our bodies where it is and notice it and notice that it's actually not harming us, and maybe breathe if our heart's racing, things like that, really tune into your mind body connection. The sooner we can do that and make our peace with it, the more we can be at ease with it and live with it and not let it, ruin our days. And this elderly woman who just talks about like the anxiety is always there, it's always going to be there. I thought that was really evolved of her, and it really made me smile. So if you're anxious, not debilitating anxiety where you can't get out of bed, but if you're anxious throughout the day from time to time, realize that your anxiety is not physically harming you and just really start to notice it. And once you notice, you can breathe. And honestly, I feel like the sooner that we make our peace with the anxious feelings, and also just have our distance from the feelings and realize that we are not our anxiety, the sooner we can have inner peace and happiness. So I hope you enjoy that. And if you like this and you want to talk more and dive deeper into this important work, book a call with me, www.priyankanayak, NAIK, coaching.as.me. We can talk, or check out my podcast, the Empowering Working Moms Podcast, Real Talk with Dr. Priyanka Nayak. You can find that on all major podcast platforms. Check that out because I talk a lot about the tips and tricks of stepping into your best life. Thanks for tuning in.